Taking medication isn't always easy. Some don't like to swallow horse pills, others can't take prescriptions due to allergens in the medicines. And I know as a parent, getting a toddler to actually take their medicine can be like pulling teeth. But Prakash Suthar with Care Pharmacy has some solutions for you with compounding. Take a look.
Compounding is the art and science of mixing the medication together to come up with a unique dosage form that fits a patient's need.
And basically, there's a lot of history behind this, and it started out this way, didn't it?
Yeah, way back 1920s, 30s, and 40s, pharmacists used to compound medication from the physician's order. Back in 1940, 50s, 60s, the big pharmaceutical manufacturers started producing these pills and dosage forms in a large bulk quantities. So there was sort of a decline in compounding interest. But lately, in last 20 years or so, there is a resurgence in terms of compounding. And with that, we are able to produce compounds with the help of new technology and new equipment that we have here to produce the medication that fits the patient's needs.
And I mean, the idea of this sells itself, really, because it's built for your specific body needs, isn't it?
That is correct, yes.
And even here, you know, I have a daughter, and when she was 3, she was diagnosed with leukemia. And at the time, she had to take all kinds of medication. And fortunately, she could swallow pills. But if somebody couldn't swallow a pill, and even the idea of a horse pill, you know, just makes anybody cringe, you can turn it into different forms, can't you?
Right. Give you an example. We have this is the popsicle. We can make, we can add the active ingredient into appropriate vehicle and make a liquid form, and we can even flavorize for the patient's need. If a child did not like strawberry, we can make it chocolate.
Cool.
Yeah.
And that's a great thing, because any parent knows it's the worst thing to try to chase a child around the house and stick something down their throat.
No, that is correct. We have occasionally made some antibiotics that the child would not take it orally, no matter what you do. And I had a case that the child was sitting in our pharmacy, and the mom was there, and I asked the child, "Is it okay if I can make a suppository?" And mom says that don't ask the question, but child surprisingly said, "Yes, I will take it," because she was not willing to accept the taste of that medication.
That is fascinating. So she actually chose that instead?
Right. Yes, right.
Now, in general, you know, what are the benefits of compounding?
The benefit is mainly improving the compliance. If a doctor gives a medication to a patient, being elderly or a child or even a pet, if you're not able to take the medication, is no use. So we can customize that medication in a different dosage form. Let's say for pediatrics, we just give an example of the popsicle. We can even make a gummy bear. We can even make different solutions. For elderly, let's say if the pill they are not able to swallow, or they have a gastrointestinal problems. And some of the NSAID drugs, non-steroidal anti-inflammatory, if they are not able to take those orally, we can make this in a topical cream. They just rub it onto the skin, and its medication is absorbed through the skin and gets into the bloodstream. So that way you minimize some of the side effects associated with oral medications. Yeah.
That's a very good point. I've learned with my gluten allergy is that wheat and all different forms of gluten are in everything, and you can actually focus on that as well, people with allergies.
That is correct. We can avoid, we can have the formulations without gluten in it. We have some capsules that are gluten-free. We have the basic powder, they are gluten-free. We can start from the pure pharmaceutical chemical, so we avoid any other things that are associated in a commercially available preps.
And we're in this room, and everything's very sterile, and that gives me peace of mind, knowing that you guys are working in such a sterile environment.
That is true. We spend a lot of time training to get this equipment in. We get proper training from the company who has been training pharmacists like ourselves for the last 25, 30 years.
And a certain amount of pharmacies say they do compounding, but there are different forms of compounding, aren't there? Different stages and levels.
That is correct. In a pharmacy school, well, I graduated I was trained just a minimum compounding. It's called wet lab. We just have ointments lab, mix some ointments together, and just basic small compounding, making solutions and ointments. When I started practicing, I had almost no experience in compounding. The extent of compounding I had to learn on my own, be a part of a group called PCCA. We are a group of about 2,000 pharmacists nationwide, and we attend the seminars, attend training sessions through them, and that's where we can come up with a quality compound product.
Good information. And if you'd like to find out more about compounding options, you can call Care Pharmacy at 434-792-8281. They're located in the Sherwoods Shopping Center in Danville, or go to care-rx.com.